as an FQHC that is primarily serving homeless and vulnerable populations, we have found multiple strategies for working with our high-risk patients. We do have folks who have significant social determinants of health needs, housing, transportation, those kinds of things. So those are wrapped around into our team-based care.
We have what's called Diabetes Impact Program, and that is, again, a team-based approach where there's a medical provider, there's a pharmacist, there's a health educator, there's a case manager. At times there's a behavioral health clinician involved in the care. Diabetes Impact meets on a weekly basis, and they see the medical provider and the pharmacist in a shared care appointment. So both those two members of our clinical team are in the exam room with the patient and discussing their conditions, their medication, their response to the medications, what are their barriers to maintaining their diet or maintaining their level of A1C. We have a relationship with the DCU medical team where they refer their patients who are high utilizers of their ED or their unnecessary hospital admissions. And we have a referral program in place where when they come in, they have a team at DCU, MCV, that will send their patients to us in a slot that we provide for them to become a patient of ours of record. So we want to become their medical home. The program has been very successful in that 41% in the first quarter did not return within 30 days. And then the second quarter, 53% of the individuals did not return for 30 days. So VCU's happy, we're happy, and we have some happy patients ongoing as well. Again, one of our cohort groups, what we do is we use our EMR and establish a patient registry of people who have different chronic conditions. And so in one case, we determined people who had A1C levels of 9 or above. So what happened is initially the average of all of the people in the cohort, the A1C level was 9.73. And after 1 year in the project, 41% had an A1C of less than 8, and 25% had an A1C of less than 7. So we know that our integrated care team, our shared model, our holistic approach, wrapping ourselves and around the individual, that it works and it helps. It's a win-win.
Well, certainly with the coaching that we have received over the past several years, we've been able to have access to best practices, workflow improvements, tools for managing our patients and for improving clinical measures.
Becoming value-based rather than fee-based has really been a benefit to our organization and our patients, and that has helped with sustainability.
So again, having our coach be a part of our team and coming in and working with, especially working with our health informatics specialist. He's relatively new, so when he came on board, this was shortly before we were part of the initiative. So our coach was able to work with him closely on obtaining the data needed for the clinical measures, and also, providing support in making sure that our data capture was good. We have developed an internal QI team that meets on a regular basis weekly. Now, that really focuses on all of these particular things, and we've been able to really hone in on some of the measures that have been critical for us to be able to not just monitor and work with our patients, but also again to be able to pull that and measure that and make sure that we're doing what we need to be doing.
The successes that we've had and the recognition that we have gained from HQI to leverage that with other funders and donors and use it as a marketing tool and a PR tool and tell the community about it, which has been an incredible boost to our organization.